Hello, everybody. My name is Daniella Munene. I'm the CEO of the Pharmaceutical Society of Kenya. And this morning, I would like to speak about last mile data as a necessity for health supply chain planning in Sub-Saharan Africa. So let's just first take a step back and just see the high-level supply chain challenges that we know of. Obviously, in any supply chain, the customer is key. And therefore, customer service and ensuring that customers are repeat customers and that the demand base grows depends on customer service. But we're still, especially in the health sector, we're still struggling to see patients as clients and customers. And this is something that we really need to look into. Another challenge that's been identified in terms of supply chain is cost control. And this is keeping your cost drivers under control so that your price is not fluctuating every day or every month. And this is so much more important in the health supply chain because these are ethical products, these are life-saving products, and we don't want to be having fluctuating prices that might end up in patients lacking their life-saving medicines. We have patients who are on lifelong medication, and they also need to be able to plan the costs of their medicines. Thirdly, planning and risk management has also been identified as a major challenge. And this really entails making an end-to-end plan and reducing your risks and having visibility of how everything is moving from factory to the patient. And this will be the focus of this presentation. But let's have a look at the other two major challenges that have been identified. The fourth is supplier-partner relationship management. In any supply chain, you need your upward and downward supply chain partners. And everybody is an equal and important partner. And if a partner downstream does not perform or is not happy with their terms, and then that just means that the health product or whatever product does not get to the end consumer in either good quality or on time or at the right price. In the health supply chain, these relationships have to be managed very carefully because we have a quality aspect to adhere to. And therefore, the upward supply chain points need to do audits and due diligence of the downward points, just so that to make sure this product reaches the patient at the quality and state that it was intended from the factory. And finally, we need supply chain talent. And this is a combination of experience and skills and education. And it has become a growing field of expertise in logistics and supply chain management. For this particular presentation, I want to focus on planning, supply chain planning, and how to manage that. So what is supply chain planning? This is a process of planning a product from raw material to the consumer. It includes supply planning, production planning, demand planning, and sales and operations planning. And I have highlighted demand planning because we're going to draw from there to go and see the data needs around that. Through well-planned and executed communication, you can reduce or eliminate delays in supply chain processes. And this is very pertinent in this time of the COVID vaccine because we're facing a pandemic. We have new products, health products and technology that we didn't have before. They have very unique supply chain requirements, cold chain requirements. And the whole world needs the vaccine at the same time. And therefore, supply chain planning has never been so important in the health sector as it is now. So let me just zero in on one aspect of supply chain planning, which is demand planning. So what is demand planning? It is the process of forecasting, predicting the demand for products to ensure they can be delivered and that they can satisfy customers. Again, think about this COVID crisis that we're having, the vaccines that are, coming out of the works. Some of them need freezing, some of them need refrigeration. They need to go literally to the corners of every country. Can we deliver them in good time, in sufficient quantities, with the right quality maintained across the supply chain? This demands a lot of planning along the entire value chain. And the goal is to strike a balance between having sufficient inventory levels to meet customer needs without having a surplus. And I might add, with also not having a deficit, because health, again, bringing this down, back to the health context, health is a right. Something like a vaccine or a medicine is not a luxury item. It's not an item that should be only available to those who can afford. And so this is planning a supply chain, particularly for the COVID vaccine, that's going to reach everybody who needs the vaccine, and everybody who wants to have the vaccine should be able to have access to it. And so that is why demand planning is so important, especially in the context that we're in right now. And so now this context brings me to the main topic that I'm going to talk about today, which is data. And data is a necessity in demand planning. So just to define data, let's define data first. It's facts and figures or information that are stored in a variety of places, such as points of sale, invoices, and the like. Data is important to business for formulating strategies, streamlining operations, introducing new products and services, and ensuring customer satisfaction. Consumption rates and inventory levels are amongst the data points that are critical to proper demand planning. Let's also remember that data has to be visible. It might exist, but it has to be visible. It has to be collected by somebody or some AI, and it has to be analyzed for it to be make logical sense for us in our planning process. And this brings us to the topic of supply chain analytics, which is the ability to use data and quantitative methods to improve decision making for all activities across the supply chain. And so we've seen that data is a necessity, okay? But the question is, do we really have this data? And in our context in Sub-Saharan Africa, certainly in Kenya, where I operate from, data is available, but it is not visible in the last mile. Yet the last mile is perhaps the most valuable data set in a supply chain, because this is where demand happens. And this is where that the people who are intended to get the product are actually getting the product. It's very easy to get centralized data, for example, import and export data of medicines and vaccines, for example, from health authorities, from revenue authorities. We tend to know, how much is coming into a country, how much is leaving a country. And these data sets can be accessed. And in fact, and this is because these are points that are highly regulated at the import and export level. But our data capture has not reached the point where we're able to follow a product from the time it enters a country to the time it arrives in somebody's home, or to the time that injection is administered to a client in a rural clinic somewhere. And this sort of data blackout really affects our demand planning and our supply chain planning. And that's the situation that we find ourselves in several countries in Sub-Saharan Africa. And this leads to expiries at centralized stores. It leads to outages of stock where the health products are needed the most. And it leads to poor health outcomes for clients that need these life-saving health products and technologies. And so as a continent, we need to focus on how to strengthen visibility and capture and analysis of data at the last mile. Think about the rural clinic, the little pharmacy outlet, the little laboratory in a border town far away from the capital. The users of services there have as much a right to health as the people in the big city. And if we're not using their data or even getting their feedback back to the center and using that to make decisions about what we supply to them, then I think the promise of accessible healthcare for all, what we now call universal health coverage, is very hard to achieve. And so I'll give an example of the pharmaceutical sector, where you can easily walk into a pharmacy outlet and make your purchase. And there's no record. There's no record of what you've bought, the batch number that you bought, the quantity you've bought. You probably don't have a receipt. It's just a transaction. And that data is lost. And that data is so important in the central part for planning. And so in this time of COVID, of new health products and technologies that we hadn't anticipated, and that we suddenly need to take out there to reach everybody, this blackout of data in the last mile is really going to be a challenge. And we're not going to be able to quantify our requirements. And so I just want to spend a little time to focus on how then do we improve data visibility in the last mile of health product supply chain. Obviously, we need sensitization, awareness, and training of the actors at that last mile, those nurses and those pharmacy technicians, those personnel that operate the last mile outlets in those faraway places. And we have to also remember that data is easier to capture when the system is a centralized system like a health system. So in the public sector, health data might be easier to capture because the county government, has a system of capturing this data. But half of our population also accesses services from private outlets that tend to be scattered and disjointed and have no centralized way of procurement or of inventory control. And so we need to bring in that data from those scattered fragments, outlets that are part of our health system, and be able to combine all the data and have a universal picture of our demand on the ground. And so we need to bring in those who are not part of the data capturing process and train them and sensitize them about the importance of keeping records at your lab, at your clinic, at your pharmacy, of the commodities, the health products that you're treating patients with, that you're supplying people with. We need to sensitize them on the minimum data sets that they should capture and the importance of this in the larger ecosystem of supply chain planning for the country. And so this needs to happen both from the public and private sector. Number two, we need to legislate because as we're holding the hand of the actors in those last mile areas, we also need to use, a little bit of a stick, because once you know that something is required by the authorities, then it's a lot easier to comply. And so in terms of the minimum data sets that are required to be captured, in terms of design of automated systems or computerized inventory control systems, the health regulators need to step in and provide guidance and provide regulations and rules and legislation around what is a minimum viable product that can capture this data and that can provide visibility both to the regulators and to the industry on what is happening at the last mile. And also, thirdly, we need to innovate. I'll give an example of the pharma sector, the pharmacy practice area, where some people have been sensitized, they've been made aware, they've been trained about how to use data registers to capture data on family planning commodities, HIV commodities. And yet it doesn't fit with their business model of how they operate their pharmacy outlet, wherever they're doing business. And therefore, we have to make the products fit for use, the data capture and analysis products fit for use by the private pharmacy outlet, the government hospital. So we can have various versions, and people can select then what they use. We can automate some of those registers. We can use mobile technology. We can use technology that doesn't have a huge dependence on internet connectivity. There are various solutions out there, and so many different areas of expertise need to come together to see what is needed to improve the overall data visibility at the last mile of health products supply chain. And without this, then for an unprecedented pandemic or an unprecedented situation that we find ourselves in, it's very difficult to quantify and plan. And so we need, as we address this current COVID pandemic, at the same time, we need to keep improving the systems that give us data visibility, because the benefit of this will be felt across many other disease areas, many other health interventions, many other public health initiatives. And really, that's my conclusion, is that without this last mile data visibility, we're running into problems, and we must address it very urgently. Thank you very much, and enjoy the rest of the conference.